in the beginning of the pandemic, you were of the opinion that this was from a natural spillover, from the origin of SARS-CoV-2 was most likely from an animal that it spilled over into human beings. Do you still have that opinion?
Well, again, let me clarify what I said and have maintained all along, because I too have concerns about the potential for what we call gain of function or clearly biosecurity of laboratories leaking out of labs. I have not seen any evidence at all that would support that, number one, this was a man-made virus. Absolutely none. Zero.
No evidence that would support that it is a man-made virus?
None whatsoever. And I, again, with my limited expertise in viral genetics, I believe the people who I work with. Now, the question is, could it, however, been in that lab and spilled out because somebody got infected, there was a lab accident, which surely can happen. And again, we don't have any conclusive evidence that that happened. I think even anecdotal evidence we've had has been very short. But I'm the first one to say I wish we'd had a much more exhaustive investigation into what happened at that laboratory, with much more transparency. I don't think we've had that kind of a transparent investigation yet to see, were there sick people at that time? Because if it was going to spread out into the population, there would be sick people. On the other hand, I'm not surprised that it might have emerged in Wuhan, because here's an area of over 40 million people living in that whole area, for which their food sources come from hundreds to up to 1,000 miles away, of which the open markets there are ripe with the kind of animals that very well could have brought the virus there. And when you look now at the ease at which this virus goes between animals and humans, at least initially, or humans or back to animals, it's not surprising that it might have emerged there. And so I'm still open to the fact that, was it a laboratory accident? I don't have any reason to believe it was an intentional one. I know it was, based on everything we have, it was man-made.
But I don't think anybody thinks it's an intentional release, do they?
No, well, some people have. No, some people think...
Well, I shouldn't say anybody. Some people believe the world's flat. Right?
That's absolutely true, too. That's absolutely true, too. So I think, but I think that it is fair to say that there still remains this question, could have it leaked out of that lab? And I continue to say, I wish we would have an exhaustive, comprehensive investigation, which the Chinese government would agree to.
Is that part of the problem, a lack of transparency?
I think it is, but let me paint a picture here that also helps explain the situation. Imagine a brand new virus emerged in the Caribbean. Okay, I mean, it came from nowhere. It might be a mosquito-borne something, okay? Where do you think they might find that virus first? Atlanta. Why Atlanta? Because it's the transportation hub for the Caribbean. And they have the sophisticated laboratories there, not even at the CDC. I'm just talking about universities, et cetera, clinicals. Imagine if that virus was found in Atlanta, a brand new virus. The assumption we made immediately, it came from the CDC. Because it's there. It's geographically there. It's in Atlanta. That has to be the source.
I see what you're saying.
And so if that were the case, imagine the Russians and the Chinese saying, wait a minute, this was a lab leak out of CDC. We want to come and investigate. We're going to come in and see. Mm-hmm. Do you think the U.S. would just willy-nilly open up the lab at the CDC to the Russians and the Chinese?
Right.
So in some ways, I'm not being sympathetic at all to the Chinese, because I think they are continuing to make the problem worse by not providing more transparency. But at the same time, if the same thing happened in the United States, I could see where we wouldn't just open up the CDC to everybody in the world to say, okay, come on in and look.
Right, but is the CDC doing gain-of-function research on coronaviruses?
They're not.
They're not. Well, if something emerged from there that wasn't something they were working on, that would probably not arouse the suspicion of the world. I think part of the problem with what's going on in Wuhan was that lab is a level 4 lab that was working on bat-borne coronaviruses.
Exactly. No, you're absolutely right about that. But at the same time, CDC might be working on a lot of the viruses that would emerge in the Caribbean. And they would have labs that were working in that, because some of their best expertise is on, for example, mosquito-borne viruses in there. So I'm merely pointing out that it's not just the fact that the Chinese have basically stonewalled us. They have. And unfortunately, I think that can be interpreted as, there's definitely guilt there.
Right.
I think some of it has to do with this issue where they just opened their lab up. I just wish they would. And let an independent group from around the world go in, examine all the records. Was there any evidence of illness around that time? Was there any unusual activity? The viruses they have, what they've self-reported, were not any that were close to this one in terms of actually, that actual virus was in the lab that was suddenly found in Wuhan. So I think it continues to be a major distraction.
Wasn't there recently a version of the virus that was discovered, a very early version of COVID-19 in one of the labs?
There's been a number of SARS-CoV-2-like viruses there, but again, this is out of my area of expertise, but the viral geneticists I know would say there surely is not the direct link yet that virus came from that virus in the lab. And so I think that, but that's the kind of thing we need to have the transparency on, and I wish we'd move on. I wish we'd move on then.
So the part of the issue is that there's just not enough data from them to make an accurate, honest clear determination.
That's what I see. And I do see a virus that right now sure is very effective at moving between people to animals.
Right.
So it doesn't surprise me that it could move from animals to humans.
Now, the people that are suspicious that this did come from some gain-of-function research, they point to that as an indicator that this is a virus that was at least cultivated in a laboratory, right?
Yeah, and I see no evidence of that. And let me just come back and add a context to this.
Okay.
I sat for a number of years on what was the newly established basic group inside of the federal government to look at biosafety and biosecurity work, okay, the national science group that did that. And, for all the years from 2005 to 2012 that I was on that, I was one of the really outspoken people about my concern about doing influenza work in labs where they were trying to understand virus H5N1, a bird virus that occasionally infects humans, but could it one day become the next pandemic virus? And a group of researchers wanted to try to gin up that virus by passing it multiple times in ferrets and looking to see, can we predict when it might become readily transmissible between mammals, i.e. could infect humans? And my concern was all along, wait a minute, what happens if this gets out? What's the challenge? You could start the next flu pandemic. So I have always considered myself kind of the champion in a way, as amongst others, of looking at biosecurity as a really critical issue. So I come into this with the Wuhan experience feeling the same way. I think this is an important issue. I think it needs further discussion. But again, I don't see any evidence at this point that anyone has provided that shares that this is what happened. But I think we just need that transparency we don't have yet.
So there's not enough evidence to draw a clear conclusion, in your opinion?
None. And
now, there is some anecdotal evidence, right? There was I believe there was 3 researchers at the Wuhan lab who did get ill with a very similar disease to COVID-19, and one of their spouses wound up dying, and there was some indication that that could have been the initial source.
Yeah, let me first of all just say, in my world, anecdotal evidence is not really evidence. You know, it's not storytelling, but I see so many of these things. Yeah, and I've never seen any of those data corroborated by any responsible group. It's kind of one-off. It's kind of that old idea. President Kennedy's secretary was named Lincoln. President Lincoln's secretary was named Kennedy. So there must be a tie between the 2 assassinations. It's that kind of thing.
Yeah.
I've seen nothing that supports that activity at all.
So as a scientist, you're just not willing to make that leap.
I'm not willing to make the leap, but I'm willing to make the leap if we get the evidence that it's there. So I'm not sitting here saying, write it off.
Right. I get it.
Yeah.
In the early days, there was some evidence that was deleted. There was a lot of files that were deleted from the Wuhan lab, and that a lot of people pointed to that as being an indicator that they were not just not being transparent, but withholding some data.
Yeah, at this point, I can't comment on that to say I know exactly what happened. There surely was some evidence that there had been some files moved or deleted. Also, there's been evidence that some of those files have been replaced, etc. So I can't comment beyond that. But again, the people that I most respect in this business who have concerns like I have not pointed to that as being any evidence necessarily that that's what happened, was that there was data that they wanted to get rid of so people wouldn't see it.
Right. It's just, again, not enough, right? Is that what you're saying?
Yeah. In fact, I wouldn't even say not enough. I would say I'm still waiting for even a limited smoking gun to come forward and say that. I just haven't seen anything like that. I'm open to it. I'm willing to it. I have said time and time again, I wish that their Chinese would allow for an exhaustive outside review of what happened there to corroborate all these pieces of information or basically show that they're not true. And I think that would put us all in a better place of trying to move forward.
Is there proof that they deleted evidence?
I don't have any proof of that. I don't know.
You don't know?
I don't know.
If there was proof that a lot of files were deleted, would that give you pause?
Well, I'd want to know why.
Right.
We delete files all the time on research things after things are completed. Now, on the other hand, laboratories typically keep everything forever because they may have to go back to it at a later date. So, I can't comment on that other than to say that should be pieces of evidence or pieces of investigation that would address that.
Now, one of the things I think that you said early on in the pandemic was you didn't think that it would that it had emerged from a lab. You thought it was a natural spillover, just simply because of the design of the virus itself, that we wouldn't design something like that.
Yeah, and I still say that's the case. I mean, this thing is so effective at infecting humans, and it only got better over time. Think what it did in Mother Nature since the first Omicron, or since the first variant occurred up to Omicron. And you can see it just got better and better at infecting humans without any hand of a man-made event. And so this thing was an evolving virus right from the start that was basically capable of infecting humans and got better at infecting humans as time went on.
So the accusations, or the people that think that it was made in a lab, how do they think that something like that would be created, and why do you think that that's not the case?
Well, again, this is out of my sphere of expertise.
Okay.
I'm not the person who can tell you from a genetic standpoint how to manipulate this virus and what to do it. As an epidemiologist, I can tell you, I've seen these other spillover events. I've been very involved with investigating SARS back in 2003 when it first emerged in China, spread around the world. I've been very involved with the work with MERS, the Middle Eastern Respiratory Syndrome, another coronavirus. And in each one of those, you can show clearly the spillover event from animals to humans. In fact, with the camels being the main reservoir for MERS in the Arabian Peninsula, we keep having MERS cases because nobody's going to put down all these camels. We're not going to get rid of them. And so we watch those spillovers occur from time to time into humans. So coronaviruses emerging out of an animal reservoir in of themselves are not unusual. It's not somehow like A plus B plus C plus miracle ended up with the answer. So I haven't seen anything that would tell me that that was any different than that. But again, I'm wide open to whatever new data can come forward, and I hope we do exhaustively look at this.